we look at the scientific reality of late-term abortion in the wake of extreme abortion laws and media misinformation. Recently, 2 Democratic governors have come out against pro-life Born Alive legislation. Born Alive legislation simply requires babies who are born alive receive necessary medical care. Wisconsin Governor Tony Evers says he will veto his state's Born Alive bill. His comments came after North Carolina Governor Roy Cooper recently vetoed the pro-life bill in his own state. Meanwhile, another Born Alive bill heads to the desk of Montana Democratic Governor Steve Bullock. It's yet to be determined how he will act. President Donald Trump addressed the Born Alive issue head-on this past weekend at a rally in Green Bay, Wisconsin, when he called out the state's governor.
But your Democrat governor here in Wisconsin shockingly stated that he will veto legislation that protects Wisconsin babies born alive. Born alive.
The president went on to say a baby is born, the mother meets with the doctor, and the doctor and mother determine whether they will execute the baby. The description was in reference to comments made by Virginia Governor Ralph Northam earlier this year.
The infant would be delivered. The infant would be kept comfortable. The infant would be resuscitated if that's what the mother and the family desired. And then a discussion would ensue between the physicians and the mothers.
While Born Alive laws do not impact abortion laws, pro-life experts say the legislation will become increasingly necessary with an uptick of extreme laws permitting abortion later and later in a woman's pregnancy, because it's more likely those babies can survive abortion attempts and will need medical care. To discuss the reality of late-term abortion and life inside of the womb, we're joined by pro-life scientist Dr. Tara Sander-Lee. She's a senior fellow and director of life sciences for the Charlotte Lozier Institute and joins us now from Milwaukee, Wisconsin. Welcome back to the show.
Thank you so much. Thank you for having me.
Absolutely. First off, I want to get your reaction to a news item right now. We are seeing the mainstream media call President Trump's recent comments on the Born Alive bill a lie and a falsehood. But can you clarify what is the reality of what may take place in a hospital if legislation like the Born Alive bill is not passed?
If legislation like the Born Alive bill is not passed, the plain and simple truth is that these babies are going to die on the table. These are babies that can feel pain, that are possibly going to be at viability status and can survive outside the womb on their own. So we need to pass this legislation so that these babies are not going to be left to die on the table without any help from physicians that are standing right next to them.
Thank you for that clarity. Do you foresee an increase in abortion survivors if abortion is permitted later and later on in a woman's pregnancy?
I do. I think the more late-term abortions that are allowed in each state in this country, it's just going to allow for more babies to be born alive, because there's going to be just more abortions that are going to be failed abortions, and so these babies are just going to be more babies are going to be left to die on the table. And again, the more late-term abortions they're just going to be more viability status. We already know that babies can survive outside the womb at 22 weeks gestation, and their survivability goes higher. Especially, we know that there's a recent Swedish study that has shown that these babies can have a 1-year survival. 58% of them will have a 1-year survival if they are given intensive care treatment once they are born. So we know that if any of these, if there are any botched abortions, that if these babies can absolutely be helped if they are at viability status.
Abortion advocates also claim women need the option for a late-term abortion to possibly save their own life. But can you clarify, is a late-term abortion ever medically necessary in order to save the life of a mother?
So based on my own research and information that I have read, it is never going to be medically necessary to kill a baby in order to save the life of a mother. So we know that especially these babies that are viability status, that if the mother is ever in an emergency situation, they can be rushed into a C-section. Within 30 minutes, they can have the baby outside and separated from the mother's womb. And if at viability status, that baby will absolutely survive. So these doctors can take can take care of both patients, both the mother and the child. And if the mother chooses that she does not want the child, then that child can be taken care of and that child can be put up for adoption. So, and even we know from the American Association of Pro-Life OBGYN, they have stated on their site that it's known that a mother is actually at a higher risk of death in having an abortion done greater than 20 weeks gestation rather than delivering a baby at 26 weeks gestation. So it's absolutely not in the mother's best interest to ever abort a child for her own health.
Dr. Sandra Lee, you recently co-authored a new paper that looks at developments in medically treating a mother's unborn child while that child is still in the womb, the patient inside of the patient. Get us up to speed. What kind of progress has been made in this arena of perinatal treatment?
So this field is an amazing field that is just advancing so quickly, and it is so exciting. Like you said, we really are now at a place in our medicine where we can treat the baby inside the womb. It is treating a patient within a patient. And so this can be in the form of interventions that are both non-surgical as well as surgical. Non-surgical meaning that, like women, we know that there are certain therapies and medicines that be given to the women that will actually help to reduce their risk of having babies with birth defects. Probably the best known example is folic acid. We know that that will reduce a mother's risk of having a baby with spina bifida. But what's really exciting is that now the field has advanced, that now we can detect these birth defects even sooner in the womb, and we can actually, these physicians can go in between like 18 and 26 weeks gestation, and they can do surgery on these babies to repair their defect so that they have much better outcomes after they are born.
And what's really an emotional topic, we have heard women say that they chose or may choose a late-term abortion if their baby has a fatal prenatal diagnosis. But can you speak to what the experience is like for parents who do not abort their baby with some type of fatal prenatal diagnosis?
So as you mentioned, parents are going to face a really difficult decision, especially for babies that are diagnosed with spina bifida right around 20 weeks, where they're given the option to either, like you mentioned, abort their baby, or they could have this awesome in utero surgery done while the baby is inside the womb, or they can wait till after birth. But what's really exciting is for parents that choose the very courageous decision and option of in utero surgery, what that means is that their baby is going to have actually much better outcomes than even if they had the surgery after birth. So for example, spina bifida is where the spinal column does not close properly during development. And so the physicians can actually go in between 18 and 26 weeks, and they can actually repair that defect by closing that spinal, that tissue, and so that it is closed up so that there's no further damage to the spinal cord. And what that means is that these babies are going to have a much higher chance of walking and walking even independently, and they're going to have much higher functioning as far as mental and motor function all around. So it is an amazing option for these parents if they have the ability to undergo this surgery for their baby.
It is really stunning, the contrast between some babies being saved in the womb while others are killed. What role does a physician's view on abortion play into all of this?
Well, we know from published articles that are out there that it is absolutely certain that, especially when you look at spina bifida, that there are going to be physicians within certain specialties that are going to be more likely to recommend termination and less likely to recommend this in utero surgery. And sadly, what this means is that 1 in every 2 babies that are diagnosed with spina bifida are going to be aborted, even though that there is this standard care option available to these families that can really result in tremendous ability of these patients to have a high quality of life and to survive very well outside the womb.
It is incredible what can be done when science and medicine are used to support life. Dr. Sandra Lee, Senior Fellow and Director of Life Sciences for the Charlotte Lozier Institute, thank you again for being with us.
Thank you so much for having me.